Welcome to our ongoing mailing video. Today we're going to just think about massage with movement, that ongoing work of thinking, what can I offer in my treatments that are going to just take the clients to a slightly different level, and what techniques we've got. Lower back pain is such a common, probably dominates on most of our work. The erector spinae group, key things to remember is that there's three muscle groups: longissimus, iliocostalis and the spinae group that run through here. The key thing to remember is that they start at the neck, or some of them do, and they come right down to the tailbone, near our coccyx, below our kind of underwear line. So it's important that we have some techniques of how we work with that. Once we've done our warm-up moves and we've done our stuff, have a think about reducing the medium. You can see here on Jamie, I've got very little. You don't want much slip. You want to be able to almost, and in the classroom I often use the word Chinese burn. You almost want to do that. So I use the couch. Remember, the couch is your friend. I lean on the couch. I put one hand maybe on the other side here, or just gently on the glute of the client, depending on where you go. Forearm, palm upwards, and then you can come up the spine. And it's using that nice edge of your ulna as you come up. Allow yourself to just come through. Think about your back leg and front leg doing that nice move rather than it being a shoulder thing, looking after you. So here we are now working on that erector spinae group really gently. You've done all your warm-up stuff. And I like this move. It kind of pushes the spinae back in to the spine, which is nice. And it's just restful. I can sit here. If you're not comfortable with that, then you can put your hand over on the other side. Again, use the couch as your friend. Really important to do. So once we've done that on both sides, then we can start to get this idea of movement. So I'm going to ask Jamie, and I tend to get the client to hold the client's pelvis. I want the client to tuck their tailbone out and then tuck it back in again. So he's rocking, again, not lifting off the couch, but just rocking on the spine. And you can see if he comes up this way, he's shortening. And then he tucks the other way, they lengthen. So we start with them being short, and then I sort of drop my palm in, my forearm in, and then he tucks the pelvis around the other way. So you're really kind of closing down the muscle and then lengthening. If you only get so far, you can do it from here again. So tuck out, perfect, and then tuck in. Lovely. Come back down to the base, tuck out. And you'll find once you start, the client really gets into understanding what's actually going on. Really effective, very simple. Making sure pain management, always really important here. On a 1 to 5, 5 will be really sore, horrible. 0, obviously painless. Get the client to manage that for you. So 2s and 3s. Less is more. Really important, simple way of working, and gradually work your way through. Obviously, contraindications around degeneration in the spine, any kind of issues, or particularly degeneration in terms of osteoarthritis, plate work, anything like that, really important to bear in mind. But generally speaking, this work is really, really effective and great for lengthening these muscles in the lower back. Okay.